Good day. My name is Tanaz McDonald, and today I will be going over the disease known as tuberculosis. Tuberculosis, or TB, is a highly infectious disease caused by the bacterium Mycobacterium tuberculosis, primarily affecting the lungs but also other parts of the body. Despite being preventable and curable, TB remains one of the leading causes of death from infectious diseases worldwide, especially in low and middle income countries. Symptoms of active TB include persistent cough, fever, night sweats, weight loss, and fatigue. This video will explore the disease through a perspective of a Caribbean citizen and will go over TB's causes, transmission symptoms, treatment, prevention, and impact of it, emphasizing the importance of early detection, proper medical care, and public health interventions to combat this disease effectively. TB has been a major public health concern for centuries. The disease exists in two forms: latent TB, where the bacteria remains dormant without symptoms, and active TB, which causes symptoms mentioned previously, and if left untreated, it can be fatal. It remains one of the top infectious disease killers globally, with millions of new cases reported each year. Diagnosis is done through skin tests, blood tests, and chest x rays. Treatment also involves a 6 month course of antibiotics, and completing the full regimen is essential to prevent drug resistant strains. Despite medical advancements, TB continues to be a significant global health issue, particularly in low and middle income countries, some of these including CARICOM countries such as Anguilla, Antigua, and Grenada. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis, a slow growing rod shaped and acid fast microorganism. This bacterium primarily affects the lungs but can also spread to other organs such as the brain, kidneys, and bones. Mycobacterium tuberculosis has a thick waxy cell wall composed of mycolic acids, making it highly resistant to the immune system and many antibiotics. Some strains have developed resistant to antibiotics, leading in multi-drug resistant tuberculosis and extensively drug resistant tuberculosis, which pose significant challenges to treatment. Understanding the causative agents of TB is crucial for developing effective treatments and prevention strategies. At this time, I will now play for you a short video while I explain to you how tuberculosis is transmitted through the air. Tuberculosis is primarily transmitted through airborne droplets when an infected person coughs, sneezes, or speaks, releasing microscopic bacteria into the air. These bacteria can remain suspended in the air for several hours, increasing the risk of inhalation by others. TB is not spread through casual contact, such as shaking hands, sharing food, or touching surfaces. Preventing tuberculosis involves a combination of vaccination, early detection, infection control measures, and public health strategies. Infection control measures include proper respiratory hygiene, good ventilation, and isolating infectious patients help limit the spread of TB bacteria. Public health education plays a key role in raising awareness about TB symptoms and encouraging timely medical intervention. Additionally, addressing social determinants such as malnutrition, overcrowding, and poor healthcare access further reduces TB risk. A combination of these strategies is necessary to control and eventually eliminate TB as a global health threat. Tuberculosis continues to be a major global health issue, affecting millions of people worldwide each year, and it remains one of the leading causes of death from infectious diseases, with approximately 10 million new cases and 1.4 million deaths annually. The disease is most prevalent in low and middle income countries, particularly in CARICOM countries. Additionally, TB and HIV often coexist, with HIV infected individuals being at greater risk of developing active TB due to their weakened immune systems. The economic burden of TB is significant, as treatment costs, loss of productivity, and long term disability take a toll on healthcare systems and economies. Tuberculosis remains a significant global health challenge, with certain countries experiencing higher mortality rates. For a visual representation of countries with the highest annual tuberculosis deaths, consider the following figure shown. Tuberculosis can have severe long-term consequences even after successful treatment. One of the most significant effects is chronic lung damage. Additionally, the disease's economic burden is significant, as many patients face job loss, financial hardship, and disruption of educational or career plans. Furthermore, even after recovery, there is a risk of relapse or infection, especially in areas with high TB rates. Overall, TB's long term consequences can drastically reduce a person's quality of life, productivity, and overall health, making early detection, proper treatment, and prevention crucial. In conclusion, tuberculosis remains a major global health challenge, affecting millions of people each year and causing significant mortality despite being a preventable and curable disease. TB continues to spread due to delayed diagnosis, treatment barriers, and drug resistant strains. The long term consequences include chronic lung damage, neurological disorders, economic hardship, and social stigma, which highlights the need for early detection, effective treatment, and global prevention efforts. Strengthening public health interventions, increasing access to TB treatment, and promoting vaccinations are essential steps towards controlling and eventually eliminating tuberculosis. Through continued research, awareness, and international cooperation, we can reduce the burden of tuberculosis and work towards a healthier future for everyone. Thank you for paying attention to my video. I hope that you learned something new about tuberculosis, and I also hope that you learned how to combat it not only on a Caribbean level but an international level as well. Thank you.